So today we're talking about using imaging data to better understand cardiovascular disease. So next slide, please, Jackie. So my name is Michelle Williams. I'm Associate Director of the British Heart Foundation Data Science Centre, and I'm the imaging theme lead. I'm also a radiologist and an academic radiologist at the University of Edinburgh with a particular interest in heart, lungs, and blood vessels and everything to do with imaging. And next slide, please, Jackie. And I'm delighted to be here today with my co-chair, who is Jackie. Jackie MacArthur is a British Heart Foundation Data Science Centre research project manager, and she's been involved in and making all of the things that we've been doing in the imaging section actually work. The other person to the other group of people to say thank you to is our amazing Data Science Centre team. We have Annette today here that's managing the webinar and keeping an eye on everything. So thank you indeed to them as well. So next slide, please, Jackie. So we're going to talk today about what this imaging theme is. We're going to talk about the imaging workshop that we held and some of the exciting outputs of that workshop. And we're going to talk about the priority setting exercise for cardiovascular imaging research that we've been doing over the past few months. And then we're going to talk briefly about our plans for the future. Next slide, please, Jackie. So the imaging theme lead. Next slide, please. What is imaging data? Well, imaging data involves everything that involves taking a picture in any shape or form of the body. So that might be as simple as a chest X-ray or as complicated as a state-of-the-art PET MRI scanner. But anything that can make an image, we're thinking about as imaging data. And the reason that this is slightly different from other types of data that we're used to, like age and medication use and outcomes, is that this is what we call unstructured data. Often this doesn't have a convenient pattern that we can use in research. So we have to think about how we analyze this data in new and interesting and exciting ways. Next slide, please, Jackie. So what can imaging data tell us? Well, it can tell us about the heart, about the blood vessels, about every bit of the body in all sorts of interesting ways. That might be shape, size, that might be function, that might be about disease, and that might be about new exciting image analysis techniques, AI and machine learning. Next slide, please, Jackie. A lot of the things that we talk about are things that we already use in everyday clinical practice, but there's other things that we don't know about that we're using in research. Next slide, please. So these sort of things that we don't know about are either things that we can see but don't really have a way to measure, or things that we can't see but the computers can see. So in terms of things that we can see but don't really use in clinical practice, this is an example of fat around the heart that may or may not be important. And there's some interesting research studies going on in this area at the moment. Next slide, please, Jackie. Next slide, please. Fantastic. So then there's the things that we don't use in clinical practice because they're hidden within the images. So this is an example of a machine learning radiomic techniques, getting extra information out of the images that we wouldn't otherwise be able to use. Next slide, please. Next slide, thank you. So most of the information in imaging data is never actually used either in research or in clinical practice. And so what we want to do at the Data Science Centre is to help researchers harness this information to do better research than ever before. Next slide, please. And part of that is combining imaging data with other information. So that might be healthcare information, medication use, outcomes, past medical history, other clinical imaging that's been happening, research imaging that's been happening. Combining all this information together, we hope will help us understand heart and circulatory disease in a better way and ultimately improve the health of patients with or at risk of heart and circulatory disease. Next slide, please, Jackie. So we've thought about the different things we can do in this theme, and there's a huge number of different things, but they roughly fit into 4 groups of things. First and most important is the patients and the public, their experience and thoughts on all of these other aspects. Then we have the data sets itself, how we draw these together, the infrastructure underlying both the data sets and also the image analysis, which is crucial. And then the analytics itself, how we can improve this and facilitate new and exciting different types of research. Next slide, please. Pulling all of this together, oh, sorry, back one slide, thank you, Jackie. Pulling all of this together is the idea that we want to create the bench to bedside for cardiovascular imaging research. There's some amazing imaging research going on in the UK, but a lot of it never quite reaches clinical practice. And we want to see the things that really work and help patients actually being used in day-to-day clinical practice. Next slide, please, Jackie. Okay, so with that, I'm going to move on now to talk about our imaging workshop that we held in November last year. Next slide, please, Jackie. So we had a fantastic range of people came to the workshop and really dedicated some time, two days, 2 sessions, afternoon and a morning, of really delving into the details of imaging research in the UK, what we currently are doing and what we could be doing in the future. So first of all, I'd like to thank everyone who took part in that workshop. It was a fantastic session and we learned an awful lot from everyone. We had a range of different people, ranging from researchers who use or want to use cardiovascular imaging, to data custodians, doctors, nurses, radiographers, representatives from our patients and public group, industry, research funders, and a whole pile of other different groups. So a real range of input to this workshop. Next slide, please, Jackie. And a lot of different imaging modalities. MRI was a common one, but also all of the other commonly used clinical imaging modalities, and some of the new interesting research imaging modalities as well. Next slide, please. The first question we asked was, what are the most important questions that cardiovascular imaging can be used to address? And you can see here a word cloud of some of the exciting things that we talked about. Jackie's going to talk in more detail about how we've taken this further into our prioritization exercise. Next slide, please. An important point was all of the challenges that people were facing when they were doing research using imaging data. One of the biggest ones was linking it to other healthcare information, but also translating the research into clinical practice, annotating images, storing images, and organizing regulatory and ethical approvals. Next slide, please, Jackie. Along with these challenges, we identified a lot of different opportunities, things that we and others can do to help facilitate imaging research at every point in the pathway that goes from funding, authorizations, curating data sets, annotating, all the way right through to getting the research into clinical practice. There's lots of different opportunities here that we can help improve imaging research. Next slide, please, Jackie. One of the important things we talked about on the second day is some of the new artificial intelligence and machine learning techniques that might be used to improve data science research even further. One of the really exciting ones is federated learning, that idea of training machine learning models without moving the data, similar to our mobile phones do every day. Can we harness that to make research that's more diverse and inclusive? Next slide, please, Jackie. There's advantages and challenges to these new AI, machine learning and federated learning techniques. And it was really interesting to get the different perspectives of the researchers and different groups that were using or trying to use these techniques, and what other people thought about them as well. Next slide, please, Jackie. Our patient and public had input, representatives were fantastic and had input throughout the meeting, and I can see a couple of them are online today, so welcome and thank you again for your input to this and all the other Data Science Centre imaging theme work that we've been doing. They raised some really important thoughts about both the concerns of imaging data research and the benefits of imaging data research. And one of the important things was, how do we improve communication around this imaging research, not just at the end when the research is done, but actually all the way through the research process. Next slide, please, Jackie. So the summary of our workshop was it was a fantastic opportunity to engage a wide range of the imaging research community and others who are interested or want to be involved in this. Communicating cardiovascular imaging research to patients and the public was a key theme, and we're working with our patient and public representatives to create web pages and content around this. Jackie's going to discuss how we've moved on to the prioritisation exercise for cardiovascular imaging research that we've been running over the past few months. And we've also been thinking about a number of driver projects, particularly things that bring together imaging research across nations, across different themes, or involve these new exciting machine learning, federated learning, and image analysis techniques. We've also been thinking about the opportunity to explore a cardiovascular imaging-based open challenge, which I'll come on to mention at the end of this talk. Next slide, please, Jackie. So putting all of this together, our aim is to improve the use of imaging data in cardiovascular research across the UK with all of these different plans that we have and a whole list of other things that we hope to do in the next year. Next slide, please, Jackie. So if you'd like to read the full workshop report, here is the link. And while Jackie's talking, I'll put that link in the chat for anyone who wants to not write it down. Next slide, please, Jackie. Fantastic. So that's the imaging workshop. I'm going to hand over now to Jackie, who's going to tell us about the priority setting exercise for cardiovascular imaging research. Now, just because I can see the numbers have increased since I started, a couple of things to let you know. Stay muted and with your cameras off while we're talking here. This is being recorded, and if you have any questions, do pop them in the chat and we'll deal with them once, we'll go through them once we've got to the end of this presentation. Jackie, over to you.
Thanks, Michelle. So as Michelle mentioned, I'm going to be talking about the prioritisation exercise that we've been carrying out for cardiovascular imaging research. As Michelle mentioned, cardiovascular imaging has enormous potential to improve cardiovascular health. It's really important that we prioritise the research that we carry out in this area. So we've been carrying out an exercise to obtain consensus on the question, what are the most important research questions that cardiovascular imaging can be used to address? For this, we've been gathering the opinions of a diverse range of stakeholders, including NHS professionals, researchers, including cardiovascular imaging researchers, data and computer science researchers, and also patients and the public. And I'm going to talk about how we've been doing this. We've been using a modified Delphi approach to gather and prioritise suggested research questions, and we've been carrying out 2 rounds of prioritisation in this exercise. In the first phase, we ran an open call for submission of research questions via an online form. This was advertised widely via Twitter, directly emailed to some of the stakeholder groups I just mentioned that we've been trying to target, including professional societies, and all the attendees of the workshop that Michelle talked about earlier. We augmented the questions that were submitted by the online form with the questions that we gathered during the workshop that Michelle just ran through. This word cloud illustrates all the questions that we gathered together. So we were submitted over 600 questions in this area. You can see the various different areas that were kind of focused on in this word cloud. And most of these involved all imaging modalities, as in they didn't focus on any specific imaging modality. So these 600 questions were first reviewed by a steering committee, which was composed of the study management team from the BHF Data Science Centre, so that's Michelle and myself, representative from the research community, and also 2 public representatives. These 600 submitted questions were reviewed and reduced to 100 by removing duplicates, questions that were not implementable, or relevant, and by combining themes together or questions that were kind of broader, focusing in on a single research question. So we as I mentioned, we narrowed these down to 100 questions, which were taken through to the first round of prioritization. And this graph represents the themes of these 100 questions. So as you can see, the majority of these were around diagnosis, but then also understanding of the disease and prognosis. So we launched the first round of prioritization at the end of June, and this ran through to the middle of August. Prioritization was carried out in an online interface called Delphi Manager, where we asked researchers and NHS professionals to rate the list of questions. Everyone that we sent it out to was asked to rate each question out of 9 based on their perception of the positive impact of each question for patients. And you can see here an example of just one of the questions that we asked people to prioritise. Overall, 94 individuals took part in the prioritisation exercise, with 87 completing the prioritisation of all 100 questions, and 7 completing the prioritisation of some of the questions. You can see here the stakeholder categories of those 94 individuals. We also wanted to incorporate input from patients and public. However, we recognised that when we reviewed the questions, that many were too technical to be able to obtain meaningful results in the same way. We therefore carried out a survey to gather input from patients and the public. The survey was carried out in SurveyMonkey, and rather than prioritising the 100 questions, we asked patients and the public a couple of focused questions. In particular, what areas of cardiovascular disease research should be prioritised? For example, should we focus on disease diagnosis, treatment, or some of the other themes that I showed in the graph earlier. We also asked patients and the public what the research questions should be prioritised on. For example, whether they make a positive impact for patients, whether they're a good use of money, or whether they have the potential to be used in healthcare. In this survey of patients and the public, we have received 354 responses. So you can see here, feeding back into the Delphi process, we carried through the results from the question prioritisation, the results from public and patient survey, and input from the steering committee, which was used to determine the top questions in the second round and how they should be prioritised. So to take the top questions through into the second round, we took through the top questions from all participants and additional questions from any particular stakeholder group. These questions were reviewed by the steering committee, and any similar questions were combined. And this gave us 32 top questions that were taken through into the second round of prioritisation. We incorporated input from the public survey to determine what these top 32 questions should be prioritised by. So looking at the results from the question that we asked the public, you can see here some of the top answers. We took through from these 3 domains to prioritise questions in the second round. So in the second round, the questions were prioritised by positive impact for patients, ability to be implemented into healthcare, and the potential to reduce inequalities in healthcare. You can also see that one of the top questions was, is it an important question to address? However, following discussion with the steering committee, we concluded that by taking into account these 3 domains, this covered the importance of the research questions. So you can see here that in the second round, which we will be launching this week, the top 32 questions will be prioritised by 3 domains, and we will be asking the same 94 individuals that completed the first round to complete the second round. The results will then be reviewed by the steering committee, and the final list of research questions will be written up for publication and will also be used to inform our work moving forwards. Right, I'm going to pass back to Michelle now, who's going to summarise and talk about our future work.
Fantastic, thank you, Jackie. And this is a huge amount of work behind the scenes that Jackie has done to actually make this questionnaire survey actually work. And we're hugely grateful for all of that. It's a fantastic exercise. So what are we going to do next? Next slide, please, Jackie. So one of the things that's jump-started a lot of areas of imaging research, image analysis, and new areas of imaging use in clinical practice is this idea of an open challenge. The idea of this is you have a data set and you have a question, a clinically focused research question, or other research around a technical aspect. And people around the world can contribute their ideas about how to solve this. And this has emerged out of a variety of things in the past in data science and AI space, and it's really taken off in the imaging research space. A couple of examples of really big successes in this are carotid artery segmentation, and my research interest area, coronary artery calcification. Coronary artery calcification analysis in particular really got a big jump start by being the focus of one of these open challenges. So we're currently exploring whether a cardiovascular imaging-based open challenge could be used to jumpstart some research in an important area. An important aspect of these previous challenges is they often only include images or only include data, but we'd like to think about including both of these things together in a new type of challenge. So this is what we're working on at the moment. We're currently forming a steering committee around that. Our fantastic imaging community has been filled out a survey for us over the past month or so about various ideas or suggestions for this. So we're going to be discussing on this, working out what we can do, working out what the Data Science Centre can do that's different and new compared to what is already being done in this area. Next slide, please, Jackie. So this will certainly be a way that you can get involved in the future. Another thing is the driver project. So there's a variety of different projects going on that the Data Science Centre is supporting that are looking at ways of analysing data in all its different forms in different ways. So our question to you is, are you planning or thinking about an imaging project that might be a suitable cross-modality or cross-nation or federated learning project? If so, do get in touch with us. Next slide, please, Jackie. So finally, I'd like to thank everyone at the Data Science Centre. Here's us at one of our away days in Edinburgh for making this imaging section so exciting and dynamic. There's obviously a huge number of different things that we could do over the next few years. And our workshop really kick-started a lot of those ideas. And which ones we do, and which ones we prioritise, it's really your help that's helped us select those. So thank you very much. And now we shall answer some questions. So if you have any questions, please do pop them in the chat. I've seen a couple come in already. So the first one from Sean Rowick. Do you think more subject matter expertise is required to create or use data from imaging compared to traditional data sources? Really important question. I domain expertise, whether it's in imaging or any of the other domains that you might be using data from, can be really valuable to facilitate how you use the data, how you interpret the data, and what the data actually means. So some of the best research groups I've seen around the world have a multidisciplinary team that really does contain a whole range of different expertise that brings things together. Is imaging different to these other groups? One of the issues with imaging is that it's very messy. Research imaging is slightly more structured and organized than clinical imaging, but that expertise of understanding what the data is, what the data means, how it's labeled, what's missing, can be really valuable. So I think until imaging data is perfectly standardized, which I doubt it ever will be, I think that expertise in imaging will be very valuable for research in this area. So there are some circumstances where it might not be necessary, but understanding how the data is stored, what the different labels mean, and actually what the images mean in clinical practice is really valuable somewhere in the team that's doing that analysis. A second question here from Zach. For an MRI scan, does the sequence type, variance in the quality of the scanner, and scanning artifacts limit the large-scale use across the nation? These are really important points. When we do a scan in one hospital, it can be very different to a scan in another hospital, done on a different scanner, with different software, with different types of images set up in different ways to the preference of the people who are analysing the scan in those particular centres. And that's a great thing for patients because we always try and get the best image quality out of the scanner at every single centre where the scans are being done. But it means that if we're doing research that involves data from different hospitals or different scanners in the same hospital, it can be challenging. And you have to work out how to harmonise those differences. It's not a bad thing for research to be done on different scanners in different places with different types of patients, because it means that the resulting research will hopefully be more generalizable to clinical practice around the UK and maybe even around the world. But it does make the research more difficult, particularly labeling and how you label your scans and how you label different components of the scans, and all of that metadata about the scans itself that tells you how it's done is crucially important and often forgotten. People suddenly jump straight into the pictures because that's the interesting and exciting bit. But actually, all that information is crucial for any research. And it does make it harder. Not necessarily limit, but does make it harder. So my hobby horse at the moment is try and make sure people are labeling everything in as standardized a way as possible. And there are some moves to try and standardize things. We do need buy-in from manufacturers on this, people who make the different types of scanners can really help with standardizing that. And we do have some standards for labeling. So DICOM is a standard for labeling imaging data and storing imaging data, which can really help with those things. But variance is a good thing in imaging research to make our ultimate research as generalizable as possible. Do we have any other questions? Anyone want to put their hand up? Fantastic. A question here from David Seymour. Has there any been discussion with centres of excellence for digital pathology and imaging? Yes. So pathology, histology, slides, all of these things are images. And yes, I've been chatting to people and sitting in with people, particularly around standardizations of digital pathology. So imaging from the Data Science Centre point of view involves all of these different things. We're obviously focusing on medical imaging at the moment because it's the first and instantly available, but there's so many other different types. Retinal imaging is one that is really important as well. Oh, I think inside Eye Health Hub, yes. So retinal imaging, I had recently at my optician's. And there's many of these images being taken around the UK, and how we standardize, share, combine, use these other types of images is really important. So yes, pathology, definitely very important. Retinal imaging, very important. ECGs as well. So these are all types of unstructured data. So if you have projects in these areas or interest in these areas, do reach out to us, and we'd love to chat to you more about those things. And I've been sitting in on some of the digital pathology meetings about how we standardize that. DICOM for digital pathology would be very valuable for the space. A lot of this is about how we make unstructured things into some form of structure that we can use for research. And that's a really important thing for big multi-center, multi-nation research. So yeah, fantastic points, David. Anyone want to raise their hands and go on camera and ask a question or have a comment? While you're all thinking, I'll maybe chat about some of the other things that we're thinking about doing over the next wee while. When it comes to how we communicate this research, what we actually talk about is really important. And when I say images, that means one thing to one person and another thing to other people. And one of the things our patient and public contributors highlighted is that not everyone realizes that the scan that they had in the hospital, the echo that they had, could be used for research in some way. So be very interested in anyone who has any ideas about how we can communicate that better, let people know that this is important information and useful information. And we're working on what sort of information about this to put on our website. Jackie, do you have any thoughts on that?
No, just so that to keep a lookout on our website, because we will be making additional information on our work and on communicating imaging research to patients and the public in the near future. I also wanted to say a big thank you actually to everybody who completed the prioritisation exercise so far, both the Delphi question prioritisation and also all the great input we had from patients and the public in that SurveyMonkey survey that I mentioned.
Thanks, Jackie. Yeah, so the prioritization exercise has been really interesting. It's the background to this is that we ran a prioritization exercise for cardiovascular imaging that was a very niche one, just computed tomography, really. And we wanted to see the wider picture of what a much wider range of researchers and clinicians and other professionals thought about how we should prioritize things. There was a fantastic range of questions that people sent us when we did the initial call for questions. The range of things that we can do in this area really is fantastic. Everything from looking at the heart for new genetic causes of disease to looking at the aorta, the retina, the brain, diagnosing, treating, managing, explaining. Trying to get the over 600 questions that we initially got submitted right down into 100 questions for the prioritization was hard work. And then trying to, once they'd been prioritized, trying to get that to 30 questions for the final round is really difficult. So we'll, in the next month, 6 weeks, 2 months or so, we'll have our final top 30 list of prioritized questions. But what I'd say to everyone is that don't forget about all that 100 other ones that may be your interest area. They're still in there. And I'm sure there'll be other things that come along in the future as well. So this is a useful guide, but the big thing for me has been the range of potential things that imaging can do. And perhaps some of these questions that are being prioritized will be the focus of someone's future research. So I can see a couple of PhD students on the call today. So perhaps some of these research questions will be your area of focus in the future. One of the things about all of the different questions was that we've made them all modality agnostic. So whether the imaging is CT, MRI, echo, X-ray, fancy intravascular ultrasound, pathology, retinal imaging, all of the questions are agnostic to which of these imaging types, so that we're thinking about the diseases itself and prioritizing that so that there's room for all of these different types of imaging. Another question from Zach, kind of related to imaging. Would 3D printing of complex diseases to help with surgical planning, educational purposes be considered or out of scope? This is fantastic fun. I have on my Christmas list a 3D printer. They're coming down in price rapidly, and you can make your own from a kit. I will not be printing anything as complex as complicated imaging things, but it should be quite good fun. Nothing is potentially out of scope of this, as long as it involves imaging in some ways. Some centres have had good use, a good experience of using 3D printing to help surgical planning. Some haven't found it so useful. Some have found it very useful for explaining complex surgical things to patients and families. And in education, these models are fantastic for teaching medical students. So nothing's out of scope. And I find this a really exciting area. I'm not sure what I'm going to print, but the first thing will be making the kit printer. A question from Matt. Of the questions, how many related to daily clinical practice use and how many how to use in research? Good question, actually. I'll have to add them up, but off the top of my head, I would say at least 80% of the ones in the top 30 questions are related to good clinical practice. How do we diagnose subtypes of heart failure? How do I identify patients at risk of future heart attacks? These sort of questions. But there are some research-focused questions as well. So how do we use imaging data to better identify patients who might be suitable to take part in research studies, for example? How do we use artificial intelligence and machine learning to, in more detail and better quality in research studies? So there are some research focused questions in there as well. I'd say roughly about 10%, but I will add that up for when we do our next webinar, which will hopefully be with the results and all the other exciting things that we've been doing. So any final questions? If not, we will draw this webinar to a close. Thank you so much for all coming. We really appreciate your help. If you have any thoughts or comments, ideas, do email and keep in touch with us. Look out for more information about our grand challenges, our open challenge that we're hopefully going to be planning sometime next year. Do look out for any other emails as things come up that we're planning further down the line over the course of next year. It's going to be a busy year. And I look forward to seeing you all again at the next webinar.
Thanks, everyone. Thanks, Michelle.
Thank you very much for coming. See you next time.